Dehydration and mental health. The silent driver of anxiety, depression, irritability, and cognitive decline. Powerful introduction, linking CNS, mind. In the previous lecture, we saw how chronic dehydration disrupts the central nervous system, altering blood flow, neuronal signaling, and brain metabolism. Now we go one step deeper. Mental health is not separate from brain physiology. Mood, emotions, focus, motivation, and resilience are biological expressions of brain hydration status. A dehydrated brain cannot think calmly, feel stable, or regulate emotions efficiently. Modern society discusses anxiety and depression endlessly. Yet one of the most basic contributors is rarely addressed: water deficiency at the cellular level. How dehydration affects brain chemistry. 1. Neurotransmitter imbalance. Water is essential for neurotransmitter synthesis, synaptic transmission, electrical stability of neurons. When dehydration occurs, serotonin down, low mood, sadness, irritability. Dopamine down, lack of motivation, pleasure, drive. GABA down, anxiety, restlessness, poor sleep. Glutamate down, excitotoxicity, mental agitation. This explains why dehydrated individuals often report sudden mood swings, anxiety without a clear cause, emotional hypersensitivity. Dehydration, stress hormones, and anxiety. 2. Chronic activation of the stress response. Dehydration is perceived by the body as a biological threat. This activates hypothalamus, pituitary gland, adrenal glands, HPA axis. Result: cortisol remains chronically elevated. Sympathetic nervous system dominates. Parasympathetic, calming system weakens. Clinical manifestations: constant worrying, panic sensations, palpitations, tight chest, overthinking, inability to relax. Many people diagnosed with generalized anxiety are actually living in a state of chronic cellular dehydration. Dehydration and depression, the biological link. 3. Neuroinflammation and low mood. Chronic dehydration leads to reduced cerebral perfusion, accumulation of metabolic waste, microglial activation, brain immune cells. This causes low-grade neuroinflammation, which blunts emotional responsiveness, reduces pleasure, anhedonia, causes mental heaviness and fatigue. This is why depression often feels like, my brain feels heavy. I am mentally exhausted. I have no emotional energy. These are physiological sensations, not just psychological thoughts. Dehydration, sleep, and emotional regulation. Sleep disturbance, mental instability. Dehydration disrupts melatonin secretion, circadian rhythm regulation, nighttime parasympathetic dominance. Poor sleep leads to reduced emotional control, heightened reactivity, poor stress tolerance. A dehydrated brain never fully rests, even during sleep. This creates a vicious cycle. Dehydration, poor sleep, emotional dysregulation, more stress, more dehydration. Dehydration and cognitive fatigue. 5. Brain fog, poor focus, and decision fatigue. Even 1 to 2% dehydration can cause reduced attention span, poor working memory, slower information processing, mental confusion. This directly affects students, professionals, elderly individuals, meditative practitioners. Many people believe they are mentally weak, when in reality, the brain simply lacks water. Why elderly and spiritually active people are at higher risk. Elderly. Reduced thirst sensation. Poor kidney concentration ability. Multiple medications causing water loss. Meditators and spiritual seekers. Reduced hunger and thirst awareness. Long sitting periods. Increased subtle energy activity requiring hydration. Higher consciousness does not eliminate biological needs. It actually demands better physiological support. Clinical and practical signs of mental dehydration. Early signs. Irritability without reason. Mild anxiety. Afternoon mental crash. Reduced enthusiasm. Advanced signs. Persistent anxiety. Low mood, depression. Emotional numbness. Insomnia. Cognitive decline. Rehydration as mental health medicine. Correct hydration principles. Prefer warm or room temperature water. Small, frequent sips. Add natural electrolytes if needed. Avoid cold water shock, especially early morning. Supportive practices. Morning sunlight. Grounding, earthing. Slow breathing. Reduced caffeine. Conscious water intake, mindful drinking. Water taken with awareness heals deeper than water taken mechanically. Conclusion. Mental health is not only about therapy, medication, positive thinking. It is about restoring the biological environment in which the mind can function peacefully. A hydrated brain is calmer, clearer, kinder, and more resilient. Before labeling yourself as anxious, depressed, or mentally weak, ask a simpler, more honest question. Is my brain adequately hydrated? Holistic Wellness Foundation. Imphal. Healing beyond boundaries.